Hello, this is Dr. Mercola, and today I'd like to discuss a simple oral health technique that many natural and biological dentists strongly recommend to improve your oral health. It's actually an ancient Indian technique that's been used for 5,000 years, and it's called oil pulling. So there are many benefits ascribed to this practice, and while I can't support every claim that's out there, I'm fairly confident of one important benefit, and that is it will likely improve your dental health. That is the primary reason why I've been doing it for the last year every day. So what is it? Well, oil pulling simply makes sense from a biomechanical perspective because bacteria, as you know, are the primary cause of dental decay. And these bacteria are made of cell membranes that are fat soluble. And these bacteria multiply very rapidly and can reach very high numbers in less than a day. So it makes sense that if you use some strategy to remove these bacteria mechanically, it would help decrease your risk of dental decay. Now, there are a number of different oils that you can use to perform oil pulling. The traditional ones are sesame and sunflower oil, but I firmly believe that coconut oil may be far better and is the one that I use exclusively, partly because these sesame and sunflower are full of omega-6 fats, and most of us get far too many of those in our diet. But coconut oil is very high in medium chain fats, and one of those is lauric acid. In fact, lauric acid is actually about 50% of the fat in coconut oil. And you might be aware that lauric acid is well known for its antimicrobial actions, and that there have been even a number of recent studies showing the benefit of coconut oil in preventing dental decay by inhibiting strep mutans, which is the primary bacteria that causes dental decay. You already know that I am a firm believer that you will improve your health if you also reduce your carbs to primarily healthy vegetables. But I also believe that most of us could benefit from dramatically reducing our protein intakes. Now, the exceptions to this, and would be those who are exercising aggressively or pregnant women because they need more, or vegans because they're frequently not getting enough. So if you reduce your protein and carb intake, you need to obviously replace them with other sources of calories. And I believe healthy fats here are your best choice. Fats like avocados, butter, olives, olive oil, nuts, and of course, coconut oil. So because coconut oil is full of these short-chain fats, it's also very easy to digest, and it's particularly helpful in making the transition from being primarily carb burning to fat burning. Because it's metabolized so quickly, you can use it as a metabolic substitute for carbs and not suffer from many of the side effects that you might, such as lack of energy as you're transitioning to fat burning. I personally go through more than a gallon of coconut oil a month, or about a quart a week. So I believe coconut oil is the ideal oil for oil pulling. So just how do you do oil pulling? Well, first thing is probably the best to do it in the morning on an empty stomach before drinking any liquids, including water. And you put about a tablespoon or so of oil in your mouth, and you'll fine-tune that after a time. But the coconut oil is a solid at most room temperatures below 75. And it just slowly dissolves in your mouth. Now, children would use less of this oil, but once you have the oil in your mouth, it'll melt, and you simply begin swishing the oil around back and forth with being careful not to swallow it. You do not want to swallow it. You move it around in your mouth, and you move it through your teeth as if you were doing a mouthwash, but don't tilt your head back and gargle with it. You don't want to gargle. So you'll find that for a few minutes the oil will start to get thinner, and as your saliva mixes with it. So you keep swishing it, and if your jaw muscles, as initially you're starting out, they get sore while you're swishing, you're putting just too much effort into it. Relax your jaw muscles. Use your tongue to help move the liquid around inside of your mouth. And when you do this correctly, it'll feel very comfortable. Because it's important to know that there's no right or wrong way to do this swishing and swallowing, but you don't want to do it forced. Just don't focus on doing it right, and just do it with a natural movement. And if you have the unbearable urge, however, to swallow, or it becomes just too unpleasant, then spit out the oil and start over again. You might have put too much of the oil in your mouth, so try it with a little less next time. With practice, this becomes a non-issue, and it's going to become as natural to you as brushing your teeth. So you want to do the oil pulling and swishing gently again, not vigorously, in a relaxed way. And you do it about 20 minutes or so, which is about the time it takes to develop this milky white consistency. I frequently do it longer, maybe a half hour, even an hour sometimes. Now, obviously, you're not going to be able to talk when the oil's in your mouth, so you want to do it in times when you're not going to be having to communicate with anyone. So Each time you oil pull, though, it can, depending on the consistency of your oil and temperature outside, it might take a different amount of time. But 20 minutes is about the time you want to do this. So, and after you'll know that you've done it long enough, because at some point the oil is going to become a sort of a thick, white, milky substance, which is an indication that you've really been pulling it for sufficient time in your mouth. Now, at the end of the oil pulling session, however, I simply spit the oil out, and it's recommended not to swallow, just but spit it out, and I spit out into the garbage disposal or into the drain or into the toilet. And afterwards, you can gargle with some baking soda solutions, maybe a cup of water with a teaspoon, tablespoon of baking soda in that, because that's going to help alkalize, change the pH of your environment to help reduce the environmental terrain and conditions so that the bad pathogenic bacteria will not be growing. Now, I personally do oil pulling every morning, but if your schedule does not allow it, you can do it several times a week or whenever your time permits. The best time to do this, however, is most likely in the morning, but I also happen to do it in the evening most of the time, which is typically several hours after I've eaten, which is, again, ideally you want to do it on an empty stomach. So the potential benefits of the oil pulling, some of the things that it can do is prevent the bleeding gums and gum disease. It can help reduce and decrease the risk of cavities and gingivitis. It can actually help prevent bad breath. And overall, it's going to strengthen your teeth and gums. So it's a really good strategy, especially combine it with this baking soda solution. Now, as I said, you can combine about a tablespoon of baking soda in a glass of water and just swish and swallow and spit it out. But you can also put the baking soda into a dental irrigator, like a water pick, or I use a hydrofloss. And that's another good strategy. And again, it's going to help change the pH. It will actually increase the pH, alkalize the system, and the pathogenic bacteria don't like this. They like more acidic environments. So just by changing the pH, it's a simple strategy that will also help radically reduce these numbers of disease-forming bacteria that can lead to dental decay and plaque. So these are really great strategies. I love them because it's simple, it's inexpensive, and it goes a long way towards preventing disease. And we all know it's so much more effective, so much more powerful to prevent disease. Because once you have dental decay, then you're left with not many good challenges. It can become very costly, especially if you have to have the tooth removed and you go through the challenge of having a root canal or an implant or a bridge. So, and all these can cost many thousands of dollars. So it seems to make a lot more sense to take these preventive strategies. But remember, the first one, even before the oil pulling and the baking soda, is to make sure that you're radically reducing your sugar and many of the carbohydrates, because that will increase the conditions that tend to lead to dental decay. So hopefully this information and strategies that I've outlined will be a really powerful tool for you and your family to continue to take control of your health.